I have the privilege of introducing to you all today some wonderful research that is happening around the motu. So it's great to have these quickfire. And again, these are just really the snapshots. So please feel, they only have 5 minutes to speak, so please feel free to go up to them and talk more to them at lunchtime around their research. And they're all doing amazing work in this space as well. So I'm going to first introduce Harmony, which already a rising star that is in the FASD space. And for those who know her, I have the privilege of working with her on a prevalence study, and she'll be there. She's energetic, she's compassionate, and I think I'll just leave her to do the introduction.
Yeah, put it in there. Thank you. Kia ora koutou katoa. I will begin by sharing some of my whakapapa. Ko Araitiuru ko mahuhu o te rangi o ku waka. These are the canoes that brought my ancestors to the shores of Aotearoa. Ko Wainakarua ko Ararawa o ku awa. These are the rivers important to my tupuna. Ko Aoraki ko Tarawera o ku maunga. These are the mountains significant to them. Ko Maoraki ko Ngā Taituria o ku marae. These are the meeting grounds of my whānau. Ko Ngāi Tahu a ko Ngāti Whātua Tūturu o ku iwi. Ngāi Tahu is my iwi through my nana and granddad on mum's side, and Ngāti Whātua is my iwi through my nana and koro on dad's side. Ko MOKI te ingoa o toku whānau, ko Harmony aho. I am Harmony MOKI, and my whakapapa is the story that connects me to my tupuna and to the whenua. Everybody has a story. For my master's research, I heard the Pūrākau or stories from 3 rangatahi with fetal alcohol spectrum disorder about their experiences in youth justice residences. YJ residences are often portrayed negatively in the media, but the Pūrākau revealed a more nuanced reality. While participants face significant challenges in their YJ placements, their stories also revealed aspects that positively influenced their overall experiences and supported their holistic well-being. By promoting these, more positive outcomes might be realised for rangatahi with FASD and YJ residences, for their whānau and for kaimahi working alongside them. In one-on-one interviews, each participant, without prompting, shared details of their journey before placement in a YJ residence. They specified what one young person labelled adversities that shaped their paths. This included being adopted from birth whānau and birth countries, the death of birth mothers, difficulties at kura followed by complete disengagement before they were 16 years old. One participant mentioned that these adversities were compounded by the difficulties associated with FASD. All participants were diagnosed as teenagers in trouble with the youth justice system. Isn't it disappointing that this is the fastest way for our rangatahi to be diagnosed? Their desire to share these really personal challenges illustrates the importance of understanding and accepting people as a whole and listening to them as experts of their own experiences. The concepts of whānau and whanaungatanga are inherent in te ao Māori, and these concepts were significant in the 3 Pūrākau. Whānau encompasses ideas of responsibility, unity, and shared understandings. Whanaungatanga refers to the connections that provide a sense of belonging. In YJ residences, staff who invested time in whanaungatanga by establishing whānau-like relationships, facilitating phone calls between residents and their whānau, and keeping whānau informed about their young person really stood out. One resident stood out above the others in getting to know the young person and taking time to establish these connections. Other things that participants mentioned was one-on-one support and the idea of wraparound holistic support, whānau-centred, And one participant who felt like they didn't get very much one-on-one support really specified that this could have been useful in their own experience. Where two young people claimed to need space from people when they were overwhelmed and getting frustrated, one said they needed people, otherwise it makes them feel more overwhelmed and more frustrated. Other things that help support their well-being, they all mentioned that they had plenty of physical activity in YJ where they could get space to go for walks and stuff like that. And although they could be fussy, the food was pretty good. We got fed heaps, they said. And that's about all I've got so far. Thanks.
Great timekeeping as well. It's 4:59, so woo! Kim, you need to beat that. So now I'm going to introduce Kim. Kim has worked for the government in various capacities for many, many years and holds qualifications in history, political science, international politics, social work and business management. She had also established an FASD support service in her local community and is currently the principal advisor at FASD. Most importantly, Kim is the proud mama of a young man with FASD and is motivated in her mahi to address the many inequities facing people with FASD in their whānau.
I was just reflecting as Harmony was talking about the kai and the importance of kai to people with FASD. You can just about win anything with that. Kia ora everyone. Ko Kim Milne taku inga. So I come from Ahuriri, Napier, that's where I'm located, and the big thing about me that I'd like you to know is, my son. That's why I'm here, and that's how I got into it. I was reflecting as some of these slides were going up before about that so often I think it was Claire who was talking about the fact that's why you get into it, you want to do better for your kids. And you become experts yourself without any intention of doing so, but it's the only way to make a difference, what you hope, in their lives. So anyway, without further ado, today I'm going to briefly summarise some research we did, when I say we, the royal we, FADSCAN, in 2023 to identify services and clinics capable of assessing for and diagnosing FASD. And it doesn't make for great listening, I'm afraid. Next, oh, it's me. No? Yes. So, one of the most common queries we get from our membership, as you probably can appreciate, is how do I get a diagnosis? Where do I go? So we set out to do so in 2023 because there was no national list. Now I know Alcohol Health Watch had done some work previously, but I think it languished a bit in later years, and so we didn't have a database. So this is the start of something we'd like to keep up to date and would encourage you, when you open all your new clinics and services, please let us know. So just for clarification, when we refer to an FASD diagnostic service, we're meaning a particular service or provider who told us they had the training to undertake an assessment to identify a person who meets the FASD diagnostic criteria that was in use at the time. And as we know, we've got our new diagnostic guidelines now. So we developed a questionnaire, sent it out, and wanted to find out what we could find out. So we asked what services are available, what is the waiting time to be seen, what is the approximate cost, what is your referral process, how can people contact them, and was there anything else that they wanted to tell us about their service. Some clinics and services chose not to fully complete the questionnaire and only share certain information for various reasons. Some failed to respond at all, despite multiple attempts to contact them. And unfortunately, this included several DHB Te Whatu Ora sites. Just didn't get back to us. So what we found out, lovely map of New Zealand is what we found out. Okay, we found that we only had 13 services able to offer an FASD assessment and diagnostic service, but 2 of those had 2 separate clinics, so technically there were in fact 15 clinics. Some private services, such as the FASD Centre Aotearoa in Tamaki Makaurau, koru specialists and others would also travel to other parts of the country to undertake an assessment. 10 of the clinics are located in the North Island, and at the same time we did the research, there were 5 in the South Island. Perhaps most disappointingly, there are only 4 CDS or DHB Te Whareora publicly funded services that could offer a diagnosis, and they were all in the North Island. They were Northland, Hawke's Bay, Taranaki and Lower Hutt. So what that meant was there was no public service that could offer a diagnosis in our largest centres. Auckland, Tamaki Makaurau, Waikato, Bay of Plenty, Canterbury, Otago. Most privately funded assessments cost between $3,000 and $7,000, way beyond the cost that most whānau could afford for such an important service that can hopefully change their lives and inform better parenting practices and so on. And we also understood from the information we received that the wait times were variable and could change, but the publicly funded services were years. Just imagine you're sitting there desperate for a diagnosis and you have to wait years to get a diagnosis unless you win a lotto. It's completely inequitable. It's just not on. So if you are interested, you can go to our website. You'll find our map and you can click on the services that are currently there. But since we did this research, and this is only a year ago, things have got worse again. And 2 services in Dunedin no longer offer a service, so we're down 2 more. So if you are a service, or you are aware of a service that offers an FASD diagnosis and assessment that is not on our database, please get in touch with me. We'd be delighted to know. And of course, the most important thing is we were pretty dismayed that since the 2016 to 2019 action plan, things have got worse, when one of the action points was to increase the capacity to assess and diagnose for FASD. However, we have some hope, as we were talking about before things cleared, that with the new revitalised action plan, and we've already heard Minister Retti's announcements earlier this year in April about training 30 new clinicians. I hope that's going well, Harsh, wherever you are. Good. And there you go. So realistically, few people will ever receive a diagnosis because so many are misdiagnosed, undiagnosed, thought of as the naughty kids at school. They don't even get a look in. So there you go. And I think I was relatively to time.
We'll skip the timing part for Kim. We have our next speaker here, Isaac. My son's also called Isaac, but anyway, he's supervised by Professor Anita Gibbs, who's unfortunately can't be here today because she's in Madrid. Attending another conference, so poor her. But we've got a wonderful Isaac here to present. He's an honours medical student at the University of Otago, doing his research project on FASD, again supervised by Anita. He's also, he did put here, keen cricketer and a quizzer, so perhaps at lunchtime we can have some quiz with him.
Awesome, kia ora koutou. When Joanna sent through asking for a biography. I wasn't quite sure what she meant by that, so yeah, it's a shame about the result the other day for the Black Caps, but the next test is coming up. So, kia ora, my name is Isaac. I am an honours medical student at the University of Otago this year, and I am doing my project looking at fetal alcohol spectrum disorder, and specifically what health professionals and allied health professionals need to know about it. So this is a modified presentation I gave to the sociology department earlier this year. I've taken out a lot of the background slides because I think we all sort of know what this is. Some of the current problems this year that I'm going to talk about today sort of affect everybody involved in FASD. So the lack of support and the lack of knowledge. Lack of support due to limited funding, or with the asterisks, that requires the low IQ alongside the FASD in order to receive funding, as well as lack of support of these health professionals that I think was mentioned earlier by Claire, that even though they may receive training, there's none of that support around to go with them. And then also the lack of knowledge. This is amongst both healthcare professionals and allied healthcare professionals, but also the general public as well. So a lot of messaging needs to be done around increasing public awareness, but also training up our health professionals as well. Before I arrived at this project, Anita, Professor Gibbs, had done a series of semi-structured interviews with various healthcare professionals and allied healthcare professionals around the country, including paediatricians, GPs, occupational therapists, clinical psychologists, midwives, nurses, all sorts of people. All people that you might consider to be part of the multidisciplinary team, or those wraparound supports that Claire also mentioned. So what we then took from this were what do we need to know and what do we need to do about it? So when it comes to the education, we need to be educating on the effects of alcohol in pregnancy. Now, fortunately, we have those new diagnostic guidelines that were released earlier this year, but still there is an inconsistent message across the country. Some professionals will be up to date on things and will have potentially gone to Canada or to Australia to receive training. Others will still say that it's okay to have a glass of wine at dinner, which, you know, how many times a week do you have dinner? That's a lot of alcohol across the week. And another thing that came up was the confidence in asking the right question. So asking about alcohol use, especially during pregnancy, can sometimes, with it in and of itself, carry a potential judgment aspect. So you need to be aware of how to ask these questions in a compassionate and caring way, and not with the finger pointing that it can do. Because obtaining that confirmation of prenatal alcohol exposure is pretty important in that diagnostic pathway. Advocating for change as well. So again, going back to needing that recognition at the national level so that the subsequent pathways can be followed. There it is there. So when it comes to providing care, a lot of what can be done is being familiar with the local services. So FASD is one of those conditions where it's not one person, no one person can solve it. It requires the skills and the expertise of many different professionals to come together. So, as has been mentioned before as well, we tend to silo things off, whether that comes to knowledge or whether that comes to professionals and what they can do. So, building relationships within communities between professionals, ensuring that information can be shared to produce the best outcome for the patient. And then I've also got down there changing of the culture. Again, going back to the reducing the stigma and the blame that comes with fetal alcohol spectrum disorder. As what I already mentioned earlier, alcohol use being a manifestation of trauma is a really interesting way of thinking about it. Because for me, not have had any FASD experience coming into this year, I truly did think it's just don't drink. That was my feelings going into it. Having read what I've read and learned what I have from my work this year and from so many supportive people, it's really opened my eyes to the vastness of the problem and the spider web and all these many things contributing to this. So I'd like to thank Professor Gibbs and my co-supervisor, Dr. Pūrākau, and we'll leave you with that from Dr. Doug Shelton. Thank you very much.
Thank you. Next we have Holly. I have the privilege of working with Holly. She's worked with me and the team at the university for the past 2 years. She really keeps me organised. I'm not really good at that. So I'm very privileged to have her as part of our team and doing a lot of the FASD work with us. So.
Ko maua te amonga, ko wairoa te awa, ko nei tahu te iwi, ko te rau aroha te marae, ko Holly tuku ingoa. Kia ora koutou, I am Holly and I am very fortunate to be a research assistant working alongside Joanna and the team at the University of Auckland, but also the wider networks and connections, many people who are here today. And I'm very excited to very briefly tell you about some of the research that we've been undertaking to address the research priorities we identified in our previous work. So just a quick reminder, these were the 3 key research priorities that Joanna already introduced us to, and I'll just go through these individually and tell you a little bit about some of the work that we're currently undertaking. So the first priority is really around understanding the prevalence of FASD here in New Zealand. So along with a team of incredible people and the team at the University of Auckland, we have obtained some funding to undertake a prevalence study. And this is a study to be based in the youth justice residence. So it's really about understanding the prevalence of FASD within the youth justice residence. And sitting alongside this study is another really important component that really seeks to understand the needs and the lived experience of rangatahi, whānau and staff within youth justice settings. We've also looked internationally, particularly to Australia and Canada, and we've done some very early consultation work around the potential of setting up an FASD national database here in New Zealand. And this work was very much around what it would take to set up a database, some of the barriers, some of the constraints, but also what this could look like if we were able to move ahead with this. We've also explored some of the data we have available here in New Zealand, really utilising the Growing Up in New Zealand study, which is a large prospective cohort study following young people, and I think they do surveys every year, and in particular looking for any relationship between prenatal alcohol exposure and children's behavioural and emotional development. So our next research priority really sits around workforce development, and Joanna's already told you a lot about some of the work we've been doing there, really just to understand the landscape, to understand the knowledge, the attitudes and practices among our professional groups. And sitting alongside that, we're also starting to explore the potential of using virtual reality to actually try and upskill our professionals. So in one study, we sat down, we did whānau interviews, we sat down with individuals with FASD and their whānau, and we said to them, what do your days look like? And what would be one of the key things you would want professionals to know? And we use this information to develop some scenarios that we are currently turning into VR scenarios. And we hope in the future that maybe we can do some more research and we might be able to see if these scenarios have any impact on professionals' knowledge, attitudes and practices for those with FASD. So our last priority really sits around supporting individuals and whānau. So I am also a researcher, so we did begin looking at what does the literature tell us. So we did conduct a review where we looked at all the international and national literature on what it is like to live with FASD. And we did identify that actually we identified 47 studies and we identified some key gaps. So one was really understanding what it is like for adults living with FASD. There's not a lot of literature, we don't really know a lot in the research space. But also there was a lack of hearing the voices of those with FASD. So there was a lot of research with whānau, a lot of research with professionals, but also a need to hear from those with FASD. We've then also been looking at some of our really rich data sets Joanna mentioned, some of our interviews and huis, and looking at the lived experiences for whānau here, and particularly looking at experiences with diagnoses and also for the entire family. And we identified that we don't know a lot about siblings, particularly siblings of those for FASD, and that's definitely a future avenue I'm particularly passionate and hopeful to explore. Alongside this, we've also been trying to look at the potential of using technology. So we know, we've heard how underfunded, undersupported FASD is, so we've been really trying to understand, can we use technology to bridge some of these gaps? So we initially started by looking at some of the technology that's been explored for FASD, and we found that in the last 20 years, only 17 studies have explored any type of technology to improve health for those with FASD or their whānau, and that none of those are publicly available. So we're also currently looking wider and looking into the other neurodisabilities, and is there anything that we can adapt and adjust and bring into the FASD space? So technology might be an avenue that we could use, but at the moment it's very under-resourced within the FASD research. And very quickly, we're also undertaking some work looking at the cost of FASD for families, and in particular looking at some of those indirect costs, so some of the things around costs with education and things like that. And another really important gap that we've also identified is actually understanding FASD for Pacific people here in New Zealand. And we're very interested in having some conversations around people's experiences and what this might look like. So I do just want to say a massive thank you to everybody who has worked with us, who continues to work alongside of us, but also our participants who have given so generously of their time and experience, who have made this research possible, and very keen to continue any conversations over lunch. Thank you so much.
We have our final speaker, Isabelle. My daughter is called Issa, so I think I kind of picked people like that. No, but Isabelle, again, she's been doing some work with us, and yeah. So she's, yes, I think we're running out of time, so I'll let Isabelle introduce herself.
Cool. Kia ora koutou, my name is Isabelle. I'm a research assistant with Joanna, and I'm helping her help out with a FASD content analysis, so really understanding what are the media narratives portrayed of people with FASD along with their wider family and support network. Okay, cool. A bit of rationale for this research. So despite its profound impact on individuals and their support network, FASD remains largely unrecognized and misunderstood due to its complexity and variability in clinical presentation and the overlap of symptoms with other developmental disorders. However, we do know that media representations play a really crucial role in shaping these perceptions and attitudes towards FASD, and therefore influencing public understanding, policy development, and lived experience of individuals affected by this condition. So we sort of based this research off of some media content analysis done in Canada and Australia, which highlight really different societal attitudes, discourse, and health messages around FASD, and particularly around their Indigenous populations as well. So this study aims to uncover the ways in which stigmatizing language, imagery, and narratives are constructed and perpetuated in relation to FASD in the media in an Aotearoa New Zealand context. So, couple more objectives. So we wanted to analyse how FASD is depicted and reported in print media in Aotearoa New Zealand, evaluate the extent to which media narratives contribute to stigmatisation or destigmatisation of individuals with FASD and their families, and also explore the potential impact of print media representations of FASD on public perception, awareness, and attitudes. So because of that, we had a pretty wide scope. This is our inclusion-exclusion criteria. We used the Factiva database, and we included any type of written media in New Zealand with any mention of FASD or FAS or any of those keywords, any with full text availability, and we had quite a wide scope. So from 2005 to 2024, we excluded social and broadcast media, anything outside of New Zealand, and anything which was not, where the main focus was not FASD or FAS. So we found 945 articles from the 1st of January 2005 to 2024, and after taking out duplicates and things that didn't fit the criteria, I believe the final number was 700 and something, 717 I think. And the reason we decided to do such a wide scope rather than finding a random sample within that scope is just the time trend analysis of how it had been framed from 2005 up until now was really interesting. So it really, so for example, I think the tallest mark there, so over 100, was in 2016, which was, if not all of the mentions of FASD were to do with Tēnā Pora, who was a individual with FASD who was wrongfully convicted of a crime that they did not commit, and so 2016 was the year he was compensated for being wrongfully imprisoned. Another interesting thing was the framing from 2024 to 2005. So FASD mothers were the big subject from 2005, and it really adopted a victim-blaming approach from back then. As opposed to now in 2024, there has been a huge mention of articles where there has been investment in research and advocacy, and while there's still a lot to do, it's looking up. Overwhelmingly, a lot of these articles have to do with FASD and crime and justice. So a lot of these mentions were people who had committed crimes, and a lot of the times it was sort of a quick mention of FASD. So this X person had committed this X crime and they had FASD. And that was really the only mention of FASD within those contexts. And again, which was quite similar to research in Australia and Canada, there was quite a big overrepresentation of our Indigenous population. And again, not much was said about their own perspectives and their own context. It was really just a kind of mention of they were also Māori. So those are our preliminary findings. I'm not quite done coding yet, so hopefully at the next symposium we'll get more results. But yeah, thank you very much.
Wow. Lots happening in the research space, eh? And good to see Joanna growing the research capability of our country, so thank you. Also very pleased, not wanting to exclude anyone, but so lovely to see two Ngaitahu in the house, with obviously a Ngāti Whātua Connect as well. So listen, that's been a full-on session, a little bit over time, but that's okay. Time is but just a paradigm. So listen, we're going to break for lunch. I'm going to kind of call you in about 1 o'clock again. Sorry, our time has been restricted a little bit, but a great session. Thanks very much for all the presenters today, and I'll also get the Slido thing up on the thing. So hey aha, I'll go through and bless our kai. Thanks very much. Looking forward to seeing you this afternoon. Kia ora.